welcome to season 4 of my podcast. Today, my guest is Dr. Ashok Menon, who is a consultant general surgeon based out of Sharjah and Kerala. Dr. Ashok used to run a medical center in Sharjah for 27 years and now runs one in Kerala. Dear Dr. Ashok, welcome to my show.
Hi, Vedant. Nice to have you here. And thank you for inviting me for your show. I've been a real fan of yours because I've been following most of your podcasts, and it has been really a pleasure to listen to you. And you're doing a great job. And I'm really proud that you're reading well and you're well read about everything. Your general knowledge is pretty good. Yeah. So what is that you'd like to know from me?
I'm curious to know what is a general surgeon? Like, what do they do?
Yeah, that's a good question. See, the point is the terminology, general surgery. So general, what does it mean? General means everything, isn't it? Yeah, from top to bottom. So initially, all surgeons, like when I had my training in the early 80s, and even before that, all the surgeons who were trained from top to bottom. In other words, they were allowed to do all surgeries pertaining to the brain, to the head, to the neck, to the chest, to the abdomen, to the limbs, and whatnot. You name it, and we do it. Okay, so that was the sort of training we had. And then what happened was, later on, maybe late 80s, they started specializing. So they had specialties coming up for each part. So you had the head and neck specialty, then you had the neuro specialty for the brain, then you had the cardiothoracic for the heart, then you had the gastrointestinal for the abdomen, and then you had the limbs, which was set right by the orthopedicians. Then you had the urologist tackling the urinary system, and so on. So, the specialty. So the entire general surgery was subdivided later on. And now a general surgeon is not very significant because now we call them remainder surgeons because there's nothing left over because everything has been divided to such an extent that the general surgeons has nothing much to do. However, I still prefer general surgery because I've been trained in all modalities and I can tackle all the cases, most of the cases, which I think is pretty good.
So basically, a general surgeon is someone who can do surgery on the heart, in the limbs, in the neck, in the nose, in the
everywhere. That's right.
Everywhere in the body, right?
That's right.
Being a surgeon sounds like being a mechanic. How does one practice to become better? Like, if you're a mechanic and a car breaks down, you can fix it. If you do a mistake, you can revert it and make it better. But for the body, you can't do that. So what does it take?
Yeah, you see, the thing is, the important thing you should know is a general surgeon is not only a mechanic, because that was the impression that was given by the West. Because if you see the history of surgery, surgery all began in India. Surgery began in India, and it dates back to, you can say, 800 BC. Shushruta was the father of general surgery. Shushruta, you must have heard of Shushruta. Shushruta was a physician, and he was considered to be the father of general surgery. And he had laid down so many rules, for the medical fraternity, which we still follow. And during his time, that is, he was between 800 to 700 BC. During his time, he has operated on most of the organs, right from the brain to the urinary bladder, the limbs, the heart, everything. And it is said that he was trained by Lord Dhanvantri. There was in our mythology, you must have heard of Lord Dhanvantri, goddess of medicine. So they say that he was trained by Lord Dhanvantri. So that's how he got his training. And he passed it on to his fellows. And thereby, he started doing all sorts of good work, wherein he developed a very good name for himself during his time. And he had also pioneered the plastic surgery, you can say, in the world, because he is the first person to invent a reconstruction of the nose. Because in olden times, what they used to do as a punishment, they used to cut off the nose of people. The kings, that's what they used to do. They used to just cut the nose off. And then Shushruta, he devised a technique wherein, he reconstructed the nose. What he did was he took a flap from the forehead. He took a V flap. He made a cut like a V, and then he turned it around, brought it to the nose, and then he reconstructed the skin of the nose, and by putting a bone bridge. So that's how he did it, and we are still following this. Now, what happened was later on, all this died off. So Shushruta has recorded all this in his book, the Shushruta Samhita. It's a textbook of medicine, one of the oldest textbooks of medicine. And he has recorded this in a book. And what happened was that this went out of reach of other people. And when the Europeans came, so the Europeans, they were not aware of all this. They were not aware of this Shushruta surgeries and all that. And then what happened was they had what we call as barber surgeons. So that was something like 1000 AD, long after Shushruta, So they had barber surgeons. So barber surgeons basically were, surgeons were barbers. They're basically barbers. And they worked in monasteries. And they were given the job of tonsuring the hair of the priest. You must have seen, the priests, they don't have hair there at that point. So they were wielding the razor, and at the same time, they were given the job of bloodletting and minor surgeries. They were asked to do minor surgeries. Okay? And generally, they were charged by carrying the soldiers during and after the battle, because you had plenty of battle there. And since they were possessing the razor and coordination indispensable, apart from cutting the hair, they could do amputations also. You understand? So that is how it has. That is how the evolution of surgery has taken place. Then later on, they found that the mortality, the death rate was very high, and the infection rate was very high of those performing surgeries like this. You understand? So that was the way the surgery evolved. That is the way it evolved.
Yeah.
Good.
The barber shop, there's that pole kind of thing. The pole with the lights.
Yeah. That's right. So all that, see, this all pertains to this, because barbers were initially, especially during the European medical practice of the Middle Ages, barbers were given a very important role. And even in the palaces, like King George, his surgery, he had a problem with his, he had a fistula, and that was operated by his barber. None other than his barber. But then, of course, that got infected, and later on that he succumbed to it. So that's the other part of the story. And the first barber surgeon, actually, he used to perform all sorts of minor surgeries, like, bloodletting and amputations when you've got infected wounds without anesthesia, mind you. There was no anesthesia during that time. But Shushruta, that's why, coming back to Shushruta, he has actually invented a way where you could anesthetize people using wine. So he used to pour wine into the wound so that benumbs that area, and then he used to amputate. You understand? Yeah.
That was really surprising. Pouring wine on someone's wound? Yeah. Wow. I wish my parents could do that to my wounds.
You know something, Vedant? You know my background, because I am from a military background, that my dad was in the Airforce, and I've been witnessing all the wars. So during the 1965 operation, that is the Indo-Pakistan war, you see, we had a lot of casualties in the Kutch front. And we had surgeons posted there. And they had to do bullet wounds. So bullet wounds, when you have a bullet wound in the leg and elsewhere, you've got to do immediate surgery, remove the bullet, or sometimes the limb is shattered, so they have to amputate them. So these things are done. So what happened was that they ran out of anesthesia. So normally we used to give nitrous oxide gas and oxygen, and we used to anesthetize the patient. So anesthesia was not there. So then what did they do? They resorted to taking alcohol. They poured alcohol, because alcohol was freely available in the military camps. So they used to take alcohol and pour it over the wound, and then they used to cut the limb. So they did that. And then these people were bandaged, and then sent in ambulances to the AFMC in Pune. And you should see loads of people coming in ambulances to Armed Forces Medical College. I was there in Pune during that time. And we used to see these people coming in all in severe pain and all that. So that's how it happens.
Were you scared when your dad went to war?
Well, I was not scared. In fact, I was thrilled. Because as you know, Vedant, I wanted to become a pilot. So because, wherever my dad was posted, he was posted in most of the flying stations. And he used to take me to the airfield, and we used to go there, and I used to visit all the cockpits of all those planes, the planes that we had those days. Like we had the Vampires, we had the Canberras, we had the Hunters. These were the planes. You don't see them now. These are all museum pieces now. So I used to, go to the cockpits of that, and I wanted to fly them. That was my ambition.
Like the Spitfires too, right?
Spitfires, yes, Spitfires, Hurricanes, and all that. And then the Wapatis. So Wapatis and Spitfires and Hurricanes came in during the Second World War. That was during the Second World War, yeah. But Spitfires went out of after the British, the Battle of Britain. The Battle of Britain was fought with Spitfires.
What was your dad's role in World War II?
Well, he used to fly. He was an air gunner, basically. So he used to sit behind the pilot because they used to have a biplane. They used to have a biplane which we call as a Wapati. It's known as Wapatis. So you're exposed from the chest above. You're exposed chest above. You see, there's no hood on top. And then the pilot sits in front. The air gunner sits at the back. And the air gunner has a ring. It's known as a gun ring. So he sits in the center of the gun ring. And as they fly, because there was a ceiling height of 10,000 feet or so. So they fly for about 10,000 feet. And when they see enemy planes around them, the air gunner, he just circles the gun ring. So when the gun ring goes in circles, it starts firing in all directions. So whichever plane is in their target will get hit. So that they used to do that. He was flying over the Burma front. And he's one of his pilots, was Air Chief Marshal Arjan Singh. He has flown with Arjan Singh. And they have flown a lot over the Burma front and that area. That is where the Japanese were involved.
I heard that you do teleconsultation now.
Yes.
How do you consult on surgery without being there physically? Do you tell the person that is doing the teleconsultation to
yes, definitely.
open the leg or
I'll tell you. What happens is now in my clinic in Sharjah, what I've done is I've trained my nurses in such a way that any physical examination has to be done. They will do it on my behalf. Right? So I will be seeing the patient lying on the couch, and then I will ask the patient. So suppose the patient comes with abdominal pain. Suppose the patient is coming with abdominal pain. So then I will ask the patient to lie down on the couch. He'll lie down on the couch, and I'll ask the nurse to examine his abdomen. Okay? And then he or she will examine his abdomen and then tell me where exactly he has the pain. Is there any lumps visible? Anything he could feel anything there and all that. So he'll give me a running commentary when he does the examination, and I'll make an inference out of it. And then, of course, we conclude, or we come to a conclusion only after doing the various investigations. Like we may have to do an ultrasound, or we may have to do a CT scan or whatever, if you have a suspicion. Otherwise, it may be just a colic, where there's no particular reason for it. So we just give them some medication, ask them to come for a review. So usually this is done, but no surgical cases are done. Like suppose he requires surgery, then what we tell him is we advise him surgery, and we'll tell him that, okay, you have to wait for surgery, or you can go to my colleague who's there in station and he will do the surgery for you. So we do the same thing here also. In India also, we do the same thing. So when I am in Sharjah, I have a teleconsultation with patients in India. So it's the same procedure. The procedure is almost the same.
So you don't ask people to open their legs and do anything to fix their bone or something like that, right?
No, fixing, see, that's what I told you, Vedant. Now fixing bones is not my territory. It's gone to the orthopedicians. So anybody who breaks their bone goes to an orthopedician. Previously, I have fixed bones. During my training, I have fixed bones. I have drilled holes in the skull. All that I've done. But now, it's history. Now, if I start drilling holes in the skull for a subdural hematoma, I'll be litigated. They'll take me to court. So that's how the general surgeons stand now.
Is there any difference between practicing in Sharjah versus India?
Well, not much of a difference because it's virtually the same. Because my specialty is the same here and there, and I have the same facility. So generally, it is the same. There's nothing much. Of course, when I'm in India, I can physically see the patient, and if there's a surgery required, I can always advise and do the surgery. Well, and if I am in Sharjah, definitely I'll do the same thing there. Otherwise, it will be all virtual. The patient will wait for me till I come there, and then I'll do the surgery.
You wanted to be a pilot, right?
Yes.
Why did you choose to be a doctor?
I'll tell you something. That's a story. So when I was about your age, that was probably 1967. So during that time, we met with a car accident. We met with a car accident while we were traveling from Bangalore to Kerala, because we used to travel by car always, right from Delhi to Kerala, Bangalore, Pune, Chandigarh to Kerala. All these things we used to do by car those days. And while traveling, we met with an accident, and I had an injury, and a blunt injury. Blunt injury means there's nothing obvious on my body. I mean, there was no cuts or bruises, but I had some abdominal pain, and I was taken to the hospital. And then there, we met a few surgeons, like a very, very senior surgeon was there who was on the rounds that day. That was in Bangalore, Military Hospital, Bangalore. And then, of course, they operated on me, and they found that they had some injury to my spleen, and they repaired it. And I was okay after them. Then soon after that, Dr. Christian Bernard, South African, he did the first heart transplant. That was in 1967, December 3rd. That was the time he did his first heart transplant. And I was really thrilled by it, because transplanting a heart is no joke. So, and that patient survived for around 18 days, the first patient. Later on, patients had a better survival. But that changed me. So, because I had been, I was hospitalized for some time, for maybe about 10, 15 days. So, seeing surgeons around, doing all sorts of positive work. Then immediately after the war, 65 operations. So I've been, into this medical field for some time, seeing patients coming in and out of hospitals. And basically what changed me was the heart transplant by Christian Bernard. Ever since that, I just wanted to become a heart surgeon. Basically, I wanted to become a heart surgeon. And it went on. But then finally, when it came to my specialization in the 80s, I took up, in fact, I got admitted to heart surgery. But my professor told me, look, if you take up heart surgery, you will be confined to heart. You will not be able to do the other surgeries. Whereas I like to do all surgeries. So then I opted out and then took up general surgery. But I have no regrets, because I've done a lot of surgeries, So I have no regrets in taking up the specialty.
That's really good, because in cricket, I'm not assigned to one specific thing. Meaning, I'm not a specific bowler. I'm not a batsman. I'm an all-rounder. I do bowling, I do batting, I do
That's
fielding.
Fantastic. Good. Who's your favorite player?
Kane Williamson. I met him.
Mm-hmm. All right.
I met him in Bombay Airport.
Okay. Who else?
Kane. I met the full of SRH in Bombay Airport. And I like MI, Rohit Sharma.
Mm-hmm. Yeah, Rohit Sharma is very good. He's a good batsman. I wouldn't call him an all-rounder.
Yeah.
Pandya is a good all-rounder.
Yeah, he is.
Yeah, Pandya is a good all-rounder. Now, these are the recent all-rounders, but initially, that is not during your time, but during our time, we had very good all-rounders, like Kapil Dev, we had Ian Botham, and, a lot of all-rounders. Viv Richards from the West Indies, Gary Sobers, they were all, legends in cricket. So if you read the history of cricket, you'll come across them. Probably your dad will be knowing.
So basically, you're an all-rounder surgeon?
That's right. I'm an all-rounder surgeon, but I told you that's all history now.
Yes.
Yeah.
What are your hobbies?
Hobbies, well, one of them is like yours. I used to play cricket. Then I used to play tennis a little bit. Then I used to do some painting. Oil painting. Yeah.
Even I play tennis. In fact, yesterday I played some tennis with my friends.
Oh, wow. That's great. That's great. Do you go for a coaching class for tennis? No?
I just, once in a while, I play with my friends.
Yeah.
but I'm pretty good.
Yeah, but you should take up tennis. It's a very good game. You should take up tennis and learn it the proper way.
But my 3 interests are cricket, badminton, and football.
Yeah.
And swimming.
So what would you like to become, by the way? Would you like to take up medicine, or what is your interest?
For me, my number 1 on the top of the list would be engineering right now.
Right.
Like engineering, designing, architecture.
Mm-hmm. That's nice. That sounds interesting.
Yeah.
Designing cars?
Designing cars, buildings, buses, trains, vehicles.
Off late, they've designed a flying car also. I don't know whether you've seen it.
I have.
You've seen that?
Not in real life, but I've seen it.
Okay. So things are going on, and a lot of new things are coming. Robotics is also coming in now.
Yeah. They're now making autonomous vehicles.
Yeah. We have a few in Dubai, the driverless vehicles. Yeah.
Yeah.
So it's going on.
Mm-hmm.
Yeah, that's right. Yes, anything more you would like to know?
No. Thank you so much for coming on my show.
Most welcome. And nice talking to you.
Yeah, this was fun.
Yeah. So you remember all these things, okay? Remember about Shushruta, you must remember, because he's the father of surgery. And it's not the Europeans who had these barber surgeons. They're totally mutilated surgery. So it's basically India, the pioneers of surgery.
Yep, it's all in my memory.
Good. And try reading all this so you can, know more about it. The history of surgery. It's very interesting.
Yeah, in Hyderabad, they have lots of Amar Chitakatha books. Maybe I'll find it in there.
Yeah, you'll find this book on Shushruta. Definitely you'll find it.
Yeah. Okay. I probably will when I go to India.
All right. Good.
Yeah.
Right then.
Bye. Thank you so much.
Bye. Take care. Love to all. Love to all. Bye.
Thank you. This was fun.
Yep.
Dear listeners, follow my Facebook page, Curious Vedant, to get updates on my upcoming episodes. To listen at leisure on your phone and get notified about future episodes, subscribe by searching for Curious Vedant wherever you get your podcasts, such as Apple Podcasts, Spotify, Stitcher, Google Podcasts, and many more. You can also listen to my show on CuriousVedant.com. Thank you for listening to Curious Vedant, and don't forget to rate and leave comments.